ICF stands for the International Classification of Functioning, Disability, and Health. It's a useful tool for healthcare providers and families to work together in helping a child reach his or her full potential. The ICF makes connections between a child's physical body functions and structures and the activities he or she is able to participate in. The ICF also includes environmental and personal factors that may affect a child's ability to take part in an activity. Let's look at an example of where environmental factors are important. Megan has cerebral palsy and uses a wheelchair. She is starting at a new school in the fall, but there's a problem. The school has no ramps or elevators, making it hard for Megan to get into the building. Using the model, we can see that the problem isn't with Megan's health condition, but is with the design of the school building, an environmental factor that we can change. So you can see that we need to think about all the different factors that contribute to a child's ability to participate, including their health condition, but also including environmental factors. It can also be helpful to think of facilitators and barriers. Megan faced an environmental barrier that had nothing to do with her condition. Doctors, therapists, and nurses often use specialist language that is hard to understand, but healthcare providers also need to be able to communicate with a child and his or her family. Clearly, we need a common language. That's where ICF and ICF course sets can be useful. These allow a healthcare team who work with a child and his or her family to learn what is important to the child and the family, and set goals. The child and his or her parents can share what the child likes to do, what he or she wants to be able to do, where activities take place, e.g. at school or at home, and what facilitators and barriers he or she is faced with during a typical day. The focus is on ability, what a child can do. We want to be able to identify and remove as many barriers as possible, and to provide facilitators where we can. Remember, we want to celebrate a child's abilities. We want to work together to help your child to reach his or her full potential. Thanks for watching. If you want to know more about the ICF, or if you have any questions, please refer to the ICF educational etool.